Good afternoon. We'll begin today's briefing. First, we'll hear from County Executive David Crowley. Next, we have Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management. Then we will hear from Darren Rausch, Health Officer and Director for the Greenfield Health Department. And we're excited to be joined by Shaitanya Brown, President and CEO of Employ Milwaukee. Thank you all for being here, and we'll start with you, County Exec.
Thank you so much, Catherine. Good afternoon. I want to start with testing. This week, the UMOS and Custer Stadium National Guard sites conducted 6,841 tests. We've been happy to see the recent uptick in people getting tested, but as you know, testing is not a one and done type of deal. So please continue to get tested if you feel symptomatic or anytime you're around people outside your household that could increase your likelihood of contracting the virus. And if you've been tested at a National Guard site, we want to again let you know that if it's been more than 5 days and you haven't received results, you can call the Wisconsin Department of Health Services, and it's open from Monday through Friday from 8 a.m. to 6 p.m. And the number is again 866-419-6988. Again, 866-419-6988. You can also visit or call Impact 211 for more details about the hotline and testing sites available near you. And as I said before, time and time again on these briefings, please be kind and cooperate with our public health officials. They're trying to do their job and keep communities safe, but they need your help in order to effectively contact trace and minimize the spread of the virus. Today, I'm happy to say that the county board, if they have not approved it, will be approving a plan to allocate $47 million of CARES Act funding to help cover emergency operating costs to help mitigate the spread of COVID-19 and continue funding community support programs that address public health and economic crisis that has been created by COVID-19 as a result. We're putting about, just to go over the allocations really quickly, putting about $30 million that was previously allocated. Funding is bringing this total to $77 million to date. About $24 million will go towards life safety measures, including personal protective equipment, increased cleaning and sanitation. Approximately $25 million will support emergency operation costs, such as enabling physical distancing and isolation in our criminal justice facility and house of correction, countywide emergency planning and communication, and increased death investigations conducted by the medical examiner's office. $27 million is slated for direct economic and public health services. And again, we're putting $5 million to support housing instability. While I'm happy to report all of this, projections show that the county financial needs could reach $300 million as direct costs, lost revenue, reopening costs, and service needs to continue to increase. Currently, CARES funding provide a temporary stopgap measure to increase the immediate needs of the county and its residents. I also want to make sure to thank our partners at the Greater Milwaukee Committee and the Metropolitan Milwaukee Association of Commerce for supporting our requests for direct and flexible funding. Milwaukee County has been on the front lines responding to COVID-19. Our residents make up approximately half of the state's COVID-19 infections and deaths. And throughout the pandemic, Milwaukee County has provided residents with critical emergency management, public health, and human services. But these urgent and critical services come at a high cost, one that could impact the county's ability to provide the standard ongoing services residents have come to rely on. And at a time when county budgets across the nation are dwindling due to the lack of revenue, the support from organizations like GMC and MMAC are needed as we fight for direct and flexible funding in order to continue to provide these essential services to our community. I'm also happy to announce that beginning Saturday, August 1st, masks or face coverings will be required on buses. Milwaukee County's transit system encouraged the public to bring their own masks, and many passengers have already been doing so to help protect themselves and others while riding the bus. In cases where passengers do not have one, the transit system is making efforts to provide free masks on buses, one per customer, as long as we have the supplies. Individuals are exempted from the mask requirements, and that includes children 2 years old or younger, anyone with a disability that makes it difficult to put a mask on, wear, or remove a mask, anyone consistently interacting with a person who is hard of hearing and primarily relies on lip reading, anyone who has been advised by a medical professional not to wear a mask because of personal health issues, anyone who has difficult breathing or is incapacitated. or anyone whose religious beliefs prevent them from wearing a face mask. For more information about Milwaukee County Transit System's response to COVID-19 and the latest policies and procedures, please visit ridemcts.com/coronavirus. And this is an issue that we clearly see being on the rise, and many more folks are actually supporting the mask update. We've seen that President Trump has actually changed his tune in saying that we need to continue to wear masks as we are interacting with one another, because it is the best tool that we have other than physical distancing to mitigate and reduce the spread of COVID-19. And finally, I want to remind folks that masks are required for anyone age 3 or older at the Milwaukee County Zoo, and we're continuing to operate at a limited capacity. And with that said, I will hand it over to Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First to our numbers, we have 17,162 cases of COVID-19 that we've seen in our community, and 374 individuals who have died. We continue to see high hospitalization numbers related to COVID-19. It's certainly good that we are not seeing increased deaths at this time, but however, we do know that, of course, deaths are quite a lagging indicator. They typically rise a few weeks after increases in hospitalizations, so we'll certainly continue to watch those numbers closely. There's been increased discussion and attention both locally and nationally on testing strategy, as well as testing capacity. We certainly, at a minimum, want everyone with symptoms related to COVID-19 to be tested. And we want you to receive results in a short time period, both to allow you to know your disease status, as well as to minimize the impact of isolation periods on jobs and the ability of people to support themselves and their families financially while they're isolating. The longer that it takes test results to reach patients, the longer that someone has to stay away from work, isolate from loved ones, and in the end, frankly, the more likely they are to break that isolation and potentially transmit disease to others. As we work locally and in the state to best target testing needs, questions have come up about sample pooling or pooled testing. So pooled sampling or testing refers to combining the tests of multiple people into a single lab test and running it through just one time. So this, in theory, allows for better conservation of testing supplies, better conservation of lab capacity. And if the pooled test comes back negative, that the virus is not present in the combined samples, you can be fairly comfortable that all the samples that were combined are all negative. If it comes back positive, then you have to go back, you run each sample individually once again and see which specific ones are actually positive so you can report those out. As you can imagine, in a community or a sample set with a low positivity rate, pooled testing can be very effective in using limited resources. However, in somewhere like Milwaukee County, for example, we have such a high rate of positivity, relatively speaking, that pretty much every pooled sample, if you combine 20, 30 tests together, almost every one of those would have a positive one, a positive test would come back positive, and would require rerunning them all individually, not really saving lab capacity or supplies. So there may be certain subsets of patients or tests that could be pooled, and we'll continue to look at that for future consideration. However, at the moment, it just wouldn't be an effective strategy broadly in our community. In the meantime, our community testing sites and our health systems are committed to supporting strategic testing to minimize transmission and inform our community members as fast as possible. So anyone certainly who has symptoms should contact their health provider to obtain a test. You can also go to one of our community testing sites, or you can call 211 and be connected with a test as well. Thank you and stay safe, and I will hand it to Director Rausch from Greenfield Health Department.
Thank you very much, Dr. Weston. It's my pleasure to join as a representative of the suburban health departments in Milwaukee County, and it is further my pleasure to talk about the data this week with all of you as we look at what's happening in terms of COVID-19 in our communities. So on the screen here, we see the daily number of cases of COVID-19 over the past 4 months, and we will note again this week that the suburbs continue to have some of their highest rates ever. Currently, it looks like we're plateauing a bit here at about 100 cases a day as a 7-day rolling average, and that's over double where we've been in the past. So certainly disease burden in the suburbs has increased pretty significantly. We see the same increase in the city of Milwaukee, but that rate currently is still below where the city of Milwaukee was back in mid-May. So again, COVID cases in our community are growing pretty rapidly, and that's something we want to continue to watch. As Dr. Weston noted, and as our data shows here, we do continue to see a downward trend in deaths, but deaths are a lagging indicator, so it often takes a week or 2 or 3 for deaths to be reported. Given that we're seeing a large growth in COVID cases among a younger, healthier population, the largest rate of growth continues to be those between 18 and 39 years of age. We would anticipate that many of those cases would not necessarily require hospitalizations and die, but we have seen both hospitalizations and deaths in that age group, so we can't rest on our laurels there. Our growth rate has been continuing. We've talked about doubling times in the past, and there's certainly some fluctuation in the doubling times, as you can see here. At one point in Milwaukee County, the rate of doubling was about 68 days. Now we're currently at 48 days for a doubling time. The rate in the state is currently about 33 days. So as our numbers have increased for COVID, those doubling rates have gone down pretty considerably. We've been tracking transmission rates for a long time, and the countywide transmission rate has been largely up and down for the past couple months. Very significantly, we see an increase of that transmission rate right around the 4th of July to above 1. At that point, the transmission rate was about 1.4. That particular rate means for every 1 confirmed case, on average, that person would be infecting 1.4 other individuals with COVID-19. It's exciting to see that the number more recently on this chart is below 1, which means we would be having less cases in future generations, but that's certainly something we need to watch very, very carefully. This set of graphs here shows City of Milwaukee on the top and the suburban Milwaukee County on the bottom. And very importantly, I'd like to highlight that really since June, the rate of transmission in the suburban communities has been higher than that of the city of Milwaukee. Hence the reason that the suburban numbers have been quite a bit higher in the last couple months than they have been at any time during the pandemic previously. As we have in the past, we continue to track several demographic trends. A lot of those are still trending in the same direction. As you can see here, we continue to see 18 to 39 as the largest population growth in terms of gross cases. But even more importantly, within the last 3 weeks, the rate of cases within those who are 18 to 39 has increased. Currently, that rate is about 25 per 1,000. That is higher than the over 80 age group, as well as the 40 to 59 age group. So we're seeing a lot more cases, but also a significant growth rate in that population. Also continuing a trend since mid-May, we're seeing an exceeding number of cases in the Hispanic population, and that certainly has continued to grow, but we're seeing within the last months a growth at a more rapid rate amongst the white population in the county. We see similar trends in hospitalizations and deaths as well, so I won't cover those in depth today, but I'll remind reporters that this report is available for you from Catherine following this briefing. Testing numbers have been followed quite aggressively by us over the last several weeks, and Dr. Weston did share some more recent data about testing in Milwaukee County. We continue to largely see tests climb. We continue to see a significant number of positive cases in any given week. The percent positivity mark is something that we've been watching very carefully. I will report that in this week's report, the positivity rate is 8.4%, and the percent positive the previous week is 8.4%. So we've been holding steady at just a little bit over 8% for the last 2 weeks. When we track daily percent positive, you see here that we've certainly trended a lot over the last several months. But within the last 14 days, we're pretty flat in terms of change. So that percent positive has been very flat over the last 2 weeks. Lastly, I'll share our spatial maps, which describe where cases have occurred in Milwaukee County. This particular map shows all of the COVID-19 incidence rate from March through earlier this week on Tuesday. So you see a lot of different spots within the county have had cases. The red spots within the county are those hot spots that we've had a lot more cases per population than other areas. And then when we zero in on this a little bit more for the current week, this is July 15th through July 21st data. Again, the red spots indicate areas of high COVID activity and high identification of COVID cases. And you can see there's a pretty significant, this week at least, there's a pretty significant hotspots across many of the suburban communities and parts of Milwaukee as well. Lastly, I just want to end with a couple statements. The data shared continues to show that COVID-19 is increasing in our community, a lot of disease circulation throughout our community. We need to consider that the current rate of COVID-19 disease in our community is impacting decisions about what a return to school looks like. Public health is working closely with school districts and parochial school leaders and charter school leaders to help make those informed decisions. It's also important to know that decisions we're making today as a collective community, the personal decisions about attending parties, group events, social gatherings, etc., are directly impacting the COVID-19 disease rates in Milwaukee County. Specifically, myself and colleagues in public health have many anecdotes and vignettes about students who attended a graduation party in another community where 18 to 20 of the students who attended that party became sick and became confirmed cases of COVID-19. This isn't just a Milwaukee County issue, it's a regional issue, it's a state issue, it's a nationwide issue. And it's important for us to understand that those decisions that we're making have impacts on the disease rates in the community. Secondly, decisions we're collectively making about wearing masks and maintaining physical distancing are also significantly impacting COVID-19 disease rates. There are many areas and many jurisdictions across the state and across the country that have put mask ordinances or mask orders in place. We know Madison and Racine and Milwaukee have such orders. In suburban communities, we know that Shorewood and Whitefish Bay both have ordinances. In other communities, discussion of mask ordinances or resolutions or guidance is continuing. That discussion is continuing. But regardless, whether there's an ordinance or an order with enforcement, or whether it's just a recommendation, we really urge you all to be wearing your mask and physical distancing and do everything you can to prevent disease transmission when you're out and about in the community. Lastly, it's important to understand that the decisions that we made as a collective whole 2 weeks ago are impacting current COVID-19 disease rates. Decisions that we will collectively make this week will impact COVID-19 disease rates in the next 2 weeks. So it's very important, and I implore all of you to do your part to limit disease spread. Thank you very much, and I'll turn it back to Catherine.
Thank you, Director Rausch. And now we'll hear from Shaitanya Brown, President and CEO of Employ Milwaukee. Thank you for joining us.
Thank you, Catherine. As the local workforce investment board for Milwaukee County, Employ Milwaukee has been very active and engaged in assisting job seekers get linked up with employment opportunities. We do understand safety first, and at the same time, we're faced with individuals who are unemployed or who've been laid off, who's looking for employment. Most recently, actually this past week, we held and partnered with the Department of Workforce Development, the Job Center of Wisconsin, City of Milwaukee, Milwaukee Common Council, Direct Connect, MKE, and LIST to facilitate the first ever statewide drive-through job fair. It was held here at Employ Milwaukee, and we also had a location at Serb Hall. And through our partnerships with the Wisconsin Workforce Development Association, the workforce boards across the state also held the same drive-through job fair from noon to 3 o'clock. At our location here in Milwaukee, we gave out 500 bags and distributed information of current openings with more than over 57 employers. there were approximately 850 job seekers that participated. And Employ Milwaukee is continuing to plan additional neighborhood-based drive-through job fairs over the next few months because we do understand the importance. And statewide, there were over 687 employers that participated with opening positions. Over 3,141 employment opportunity and packets were distributed with an additional 687 job seekers that directly participated across the state. So that right there shows there's a huge need for individuals to connect to employment, but again, promoting safety first. We also, this summer, normally Employ Milwaukee would have around 1,200 young people that we would put to work through our Earn and Learn Community Work Experience program. That was significantly downsized, but we were able to put approximately 500 young people to work through paid work experiences despite the pandemic, because again, we understand the importance of young people having something to do for the summer. All the information pertaining to employment opportunities can be found at www.employmilwaukee.org. Also, we've been working with the Department of Workforce Development and our community partners to reopen our American Job Centers. At this time, they're available by appointment only. So for our Milwaukee locations, if you dial 874-0318 or you visit www.wisconsin.gov/COVID-19/public/det.htm. At that point, you can schedule an appointment because we have a lot of individuals, especially with the $600 potentially running out and additional unemployment benefits looking for employment. We also have our dislocated worker programs, and this is for those individuals who've been laid off from their employers. We get warn notices and we try and reach out. Well, we have to do this in a way that's non-traditional because ordinarily we go into employers and meet with the employees prior to being laid off. But in these particular instances, we're trying to reach out to the employees now after the fact that they've been laid off. So there's a number of activities that we have planned around that, such as the virtual job fair that we did about a month ago. We have more planned activity around that, doing more of the drive-up job fairs, as well as looking at bringing on other community resources for those individuals who might be looking for something more than just employment. Other programs that we're offering and we're recruiting for is we have our work readiness, virtual job readiness training that individuals can go onto our website and register for. We just started our first session July 21st, but if there's interest, individuals can go on our website and sign up for that. Another very, very important partnership that we've launched is our Community Resource Navigator program with the City of Milwaukee and WRTP Big Step. This is our humanitarian effort to really deploy individuals into the community to be those extra set of hands to help out, whether it be at community-based organizations, faith-based organizations, clinics, just where there's extra hands that are needed. And those individuals we're targeting to do this work are individuals who's been laid off, who was laid off prior to the COVID-19 happening or the pandemic, individuals who may have been long-term unemployed, and individuals who may have had businesses that they had to shut down, but they're looking for work. We're paying those individuals $17 an hour, up to 25 hours a week, and we're still recruiting for that. So if you go to our website, www.employmilwaukee.org, the very first thing you'll see pop up is a link to the Community Resource Navigator. We also are recruiting for apprenticeship pathways. So if there's individuals between the ages of 18 and 24 who's looking for an opportunity, again, come to our website. There's an opportunity for you to sign up there. We're expanding our Tech Hire program. It's a cohort-based training program, 16 weeks for individuals interested in information technology. We are actively recruiting for the next round of cohorts. We have our BankWorks program, which is ideal for job seekers looking to get into the financial industry. And then we have our Center for Healthcare Careers, that individuals who's interested in healthcare options and getting into some training, they can contact us via our website to get that information. While we understand that, we are always promoting safety first, and here at Employ Milwaukee, we have our own computer lab and resource room that individuals have been familiar with coming with. And we're looking at in the next couple of weeks of finding a way to open up our resource room and computer lab so individuals can come here and be able to get job search assistance, do resumes, and also apply for unemployment benefits. All of the information that I've mentioned can be found at www.employmilwaukee.org. I thank you for the opportunity for us to be on today and be able to talk about what we're doing here at Employ Milwaukee.
Thank you, Shaitanya. That's a lot of resources available to our community, and those are especially critical now. So we really appreciate all the hard work Employ Milwaukee is doing, and thank you for sharing those resources. We'll now move into the question and answer portion of our media briefing. And our first question comes from Casey Cronus with Fox 6 News, and it's for County Executive Crowley. She says, the White House has suggested that federal agents might be sent to Milwaukee. Do you have any additional information on whether or not this will become a reality, and what is your reaction to the possibility of this?
So from my knowledge, we as Milwaukee County or the state of Wisconsin has received any confirmation related to this. So this is still a hypothetical situation. And so I guess my comment is that we're going to continue to stay focused on making sure that we have a healthy community and provide access to critical services that we are providing right now. Again, we can think about those hypotheticals. At the very least, if something like that is to happen, I would just hope that a conversation with local officials before something is confirmed.
Thank you, County Executive. And while you're still here, her next question is for you as well. She says, have Milwaukee officials been in touch with Chicago's mayor in regard to the possibility of Wisconsin being added to the Chicago's emergency travel order? And will there be expectations? And will there be expectations for people who live in Chicago and work in Wisconsin?
So I personally have not been in contact with the mayor of Chicago, Mayor Lightfoot, about this issue. Again, we've been focusing on how we can continue to keep Milwaukee County healthy. But I think that, to answer that question is we just have to do our part in making sure that we can minimize the spread of this virus. And so I guess my call to action would be is that we need to work with our local municipalities and putting together some ordinances, whether those are masks or finding ways to continue to minimize this spread so we don't have to get on the travel ban list.
Thank you, County Executive. Our next question is from Sharon Bagenda with CBS 58, and it's for Dr. Weston and Director Rausch. She asks, as municipalities begin to enforce mask mandates, when do we expect to see how masks have helped to reduce case numbers and percent positives in our area? Or is it too challenging to measure something like that?
Sure, well, I can chime in first, and then if Director Rausch wants to expand. I think it's very hard to measure something like that. There's a lot of moving pieces. There's people going out more, going out less, children, engaged in summer activities, eventually going back to school. I think what we know is that the evidence has shown us that masks prevent the transmission of disease. And so it's important for everyone to wear masks when they're out in public, when they're in close quarters and have trouble distancing, certainly when they're indoors with people who are outside of their household. It'll be hard to tie, in a smaller community like this, tie mask usage to a decrease in numbers.
Right, I completely concur. Just teasing apart whether the mask ordinance made an impact or people got the message and closed their circles and stayed more within their primary family units and restricted visits to parties and out in the community. It's going to be really hard to know that impact. But nonetheless, I think masks are very important and one of the very important strategies to use when you're out and about. In addition to physical distancing and increased sanitation.
Her second question, and I'm not sure if you have anything else to add, but she asks, what advice do you have for those young people who do continue to gather consistently?
I think my advice, and I've said this before, is certainly young people can get sick. We've seen that across the country, but it's rare. Young people don't get sick nearly as much as older people. Young, healthy people don't get sick nearly as much as people with other health conditions or immunocompromise. But as we've said before, young people don't live in isolation. They interact with people who are older. They interact with people who are sicker. And a lot of folks are sick and you don't know it. We don't know who around us is immunocompromised. We don't know the health information about everybody we interact with. And so, when we see increases in certain age groups, we saw an 84% increase in our 10 to 19-year-old age group. Are a lot of those kids going to get really sick with this? Probably not. But are a lot of those kids going to interact with older people, people with worse immune system, people with other illnesses? Absolutely. And that's going to lead to increased spread, increased hospitalizations, and unfortunately increased deaths.
Thank you, Dr. Weston. Our next question is from Nick Bohr with WISN 12, and it is for Dr. Weston and Director Rausch. He's asking, is there a standard or criteria for school testing to have in-person classes and have many positive tests? Oh, sorry. All right, let's try this one again. Is there a standard or criteria for school testing to have in-person classes, and how many positive tests would it take to shut down a school?
That's a good question, and I don't know if it's one that we even have an answer to yet. COVID-19 is completely new. COVID-19, there isn't a blueprint or a set of rules here. I do know that a lot of the discussions with schools center on how do we move in and out of different phases. Those different phases could include in-person learning, hybrid learning, or virtual learning. What does the data tell us, and how do we move in and out of those phases? And we're still working on that. And we know that our partners at the state, both in the Department of Public Instruction and the Department of Health Services, are still working on that as well. What's difficult, I think, to know and to try to tease out is what's specifically happening in the school. And again, because of our young people might have no symptoms or more mild symptoms, I don't know if looking at just the disease rates in that school is going to be effective. I think we're going to have to use what's happening in the schools in addition to what's happening in the community as a way to gauge and measure what impact COVID-19 may have on the school.
Thank you. And Dr. Weston, anything additional to add there?
No, I think that was a perfect summary. I think the take-home point is just as Director Rausch said, it's going to be a dynamic situation. Having huge numbers of kids in a time of pandemic going back to school, it's going to be necessary, but we need to be cautious and able to adapt as we move forward, because it's going to be ever-changing.
Thank you both. And I believe what I see is our final question in the chat is from Allison Durr with Milwaukee Journal-Sentinel, and it's for the county executive. She asks, following up on your statement for the potential of federal officials to come here, do you think federal law enforcement would be helpful or harmful to Milwaukee? And what questions would you want answered before federal law enforcement were to come to Milwaukee?
Well, I guess the first question is, why are you coming? When you think about them coming, they have not talked to any of us. We have not requested them to come. And I think that it would be harmful, because it would be more of an escalator bringing in federal officials. We've seen what has happened in Portland, and I don't think that we are actually asking for them to be here, because we have been able to talk and have conversations locally. And when you think about the protests that we've seen throughout Milwaukee County, they have been extremely peaceful.
All right, thank you very much. And it looks like that was our final question for today's briefing. So with that, thank you all. We'll give a little bit of time back into your day, and we'll see you next week.
Have a good one, everybody.
Take care.
Thanks.